faces today. Obviously, you guys know we are senior nursing students, and this is our labor and delivery rotation, so we're doing skits. And today we will be presenting a skit that showcases the disparity among the LGBTQT community and healthcare professionals. So studies have shown that lesbian, gay, bisexual, transgender, and queer identified individuals experience a lot of health issues and inequities. So they have chronic health conditions, mental health conditions, and it has been shown that a lot of healthcare professionals are not adequately educated on how to approach and how to take care of these patients. So as nurses and healthcare professionals, we must evaluate and hold true to our personal, religious, political, personal beliefs about how we approach the LGBTQT community, but we always have a duty to respect and dignify the human being. So please let me welcome to the stage Brenna Mitchell as Dr. Mitchell, Harvard MD, and then Hannah Martin as Nurse Hannah. Okay. Jamie Clark as James Clark, our transgender male who's seeking medical care at a women's clinic. And myself, Jackie Glaska, the narrator. So we do know that this is a controversial topic, but it is something that is becoming extremely relevant in our society today, and a lot of hospitals do have policies that include the LGBTQT community in their non-discriminatory acts. So, without further ado, scene one.
Hi, Dr. Mitchell. Your patient in room 1 is a 27-year-old female, 24 weeks gestation, gravido 1 per D0, GBS positive and rubella immune. She came in for signs of preeclampsia.
Thanks, nurse. Let's go meet her. Knock, knock.
Hi, Hannah. I'll be your nurse today, and this is Dr. Mitchell.
Hello. Hi, Jamie. I understand you're 27 years old, your first pregnancy, and you're experiencing episodes of high blood pressure. Is that correct?
Yes, but I'm male. I've been identified as a male since I was 13 years old, and it's changed.
Okay. So she has a history of asthma. She has a family history of hypertension, and
It's he. I told you before, it's he.
did you see the sign when you walked in this door? It said a women's clinic. So either let me do my job or get out. I'm gonna get my stethoscope.
All right, so a study was conducted on primary care providers and their education and beliefs to the LGBTQT community, and it revealed a lack of cultural competency and a lack of education, and there was negative attitudes, biases, inconsistencies in clinical practice, and deficiency in medical knowledge on how to treat the patient. So there's a greater need for comfortability, competency, and education in the needs management, referrals, and care to the LGBTQT community. So providers need not act against their personal beliefs, but they do need to treat the patient with care and respect and dignify them. As nurses, we collaborate with physicians, so it's our job to do no harm to the patient with our collaborative team delivering care, and that means whatever kind of harm that could be, mental, physical, or emotional. So stay tuned to see how Nurse Hannah resolves the situation.
I literally don't understand why it's so hard to just call me by what I've been preferred to be called as since I was 13 years old. Why is that such a big deal? I don't get it. And just because he's a freaking Harvard doctor, he has the audacity to think that he could call me biologically a woman. I don't care. I'm a male. I mean, yeah, I stopped my testosterone treatment 6 months ago, but that doesn't mean anything.
It's alright, we just gotta focus on our baby and just get the medical help that we need. And this is the only place our insurance is accepted, so just ignore whatever they're saying and just do this for our family, okay?
No, I'm gonna write a letter.
No,
No.
just
No.
calm down and
No,
just focus.
I'm not gonna calm down.
I understand you're upset. Trust me, I'm upset too. We just gotta
It's not
focus.
fair.
We'll just be done in an hour or so. We just gotta focus on our baby, okay? I understand.
I'm sorry for this incident. You seem
Are
really
you?
upset. Is there anything that I can do to help you or make you
No.
feel better?
There isn't.
Would you like
She's
to
just
talk
trying to
about
help.
it?
Trying to yeah. Guess so.
Alright, I'm just gonna take your blood pressure real quick. Just try to calm down if you can. Take some deep breaths.
Calm down. Oh, like you understand.
Alright, just be a minute.
Okay, we'll get through this.
Will we?
I hope so.
Alright, so your blood pressure is still pretty high. You seem like you're still pretty anxious.
You think?
Yeah, is there anything, are you sure there's nothing that we can do to help you?
Nope. Nothing.
Is there anything, any kind of like, things that she does at home to help relieve anxiety or stress?
Oh, I have this. Is it Mayan? And we met in Mexico, so it might take us back to like when we first fell in love.
Oh, that's so sweet. Well, maybe this will help you just like calm you down, and make you feel better. And I'm gonna go collaborate with the doctor, but I'm gonna pin this in.
A little better. Spirits are helping.
So,
Alright, I'm gonna go talk to your doctor.
Can we get that sage from the car?
Okay, so Nurse Hannah assessed the situation and mentally formulated the nursing diagnosis of anxiety related to interaction with doctor and concern about health status, as evidenced by elevated blood pressure and increased heart rate and respirations.
Dr. Mitchell, do you mind if we talk briefly before we go back into the patient's room?
sure, can you believe this?
Well, that's actually what I wanted to talk to you
Great,
about.
you agree with me, right? I mean, this is ridiculous.
Well, not exactly. It doesn't really matter if I agree or not, but we have to respect each patient with dignity and to treat her for what she's here for, which is preeclampsia. When she came in, she seemed pretty calm, and since then she has been showing signs of high anxiety. And with a patient with preeclampsia, that can have a very bad effect on it, as you probably know. What would you like to do for her treatment plan?
Okay, so what the BSN nurse here is showing patient advocacy and benevolence, so she's doing no harm. It is important for the nurse to build a therapeutic relationship and a trusting relationship with the patient. So Catalano's book defines this as trust can be established by a show of respect to the other person's opinions, ideas, and behavior, even though you do not agree with it.
Oh wow, look who's back.
Hi, so we talked, Dr. Mitchell and I talked it over, and we came up with a plan of care for you to bring down your hypertension so that it's safe for you and your baby, because we want to act as an advocate for you to make sure that you and your baby are safe.
Sorry I was rude before.
Are you? Apparently in Harvard they didn't teach you manners.
We're coming up with a treatment plan to address your hypertension.
Is politeness mixed up in there too?
Okay.
Fair enough.
Just trying to help. Listen to her.
Is it okay if I listen to your heart sound?
Sure, didn't they teach you that at Harvard? I have your letter right here, by the way.
Great.
So we just wanted to make sure that you get the best care that you can, and apologize for any bad character that you may have experienced or felt that you were being looked at as. So we just want you to know that you are respected and dignified here at our clinic, and that we want to make sure that you and your baby are safe. So Dr. Mitchell said that we can give you some antihypertensives to help you, and then you can come back in here again to get a checkup, and we can keep up to date with you and your baby.
So I'll write the scripts for antihypertensives.
Thank you. Thank you so much, Hannah. You're just the best. I'm just thanking her. She's a good patient advocate.
With words.
Okay.
Okay, so as student nurses, we must be aware of the LGBTQT community. A study was shown that despite high comfort levels and positive attitudes of nursing students towards the LGBTQ community, most students, respondents did report not enough formal preparation before going out into the work field. So that is something that has to be addressed and is very relevant to today.
And as nurses, for all patients, a nurse uses the nursing process in her plan of care, and she or he will encounter many different patients from various cultural, spiritual, and social backgrounds, requiring her to shift her approach to the patient based on their specific needs. The childbearing experience differs greatly between individuals and based on the patient's past experience, influences, cultural traditions, and beliefs. The nurse must tailor her interventions to meet the client's needs, especially in LGBTQ patients who may have reservations about health care visits and have increased rates of mental illnesses such as anxiety and depression. So whether someone is at risk or normal labor, the nurse must deliver culturally competent care, patient advocacy, and patient-centered care that promotes the safety and well-being of the patient. Also following the ethical reasons of doing no harm and to respecting the patient and understanding her own beliefs before going into the patient's room.
And also understanding your own. So the first time to be thinking about this sort of situation is not like when you have a patient like this, is to like think about these things before. Especially, it might not come up here in Florida, but a lot of us are from states where this is a very common occurrence. And a lot of like northern hospitals and California hospitals actually have parts of their non-discrimination clauses that say nurses will address the clients in the way they prefer to be addressed, which is something you definitely want to look into before you get a job at one of those places. If you're okay with that or not.
So how you can do that is if there's a chart I found on on the internet about different pronouns that you can use that are very gender fluid. So the classic one is they or them, or you can use refer to them as you, even if it's not like not trying to like push beliefs onto somebody else, but that's going to be the best to build a therapeutic relationship with them, because if you aren't like not like compliant, but if you're like calling them by something that they would prefer not to be called as, it can really inhibit their like the care that you're giving to them, because they're not going to want to trust you if you're not going to listen to them and act out what you would prefer them to be called. But also, we're not trying to say that you need to change your ethical or religious beliefs or anything like that whatsoever. It's just this group of people, transgenders, usually have very fragile like self-esteem and things like that. So calling them by their preferred identity is very helpful to them in their sense of self-worth. So it really helps as the nurse to build that relationship with them if you call them by gender fluid terms as well, besides their preferred.
And we tried to keep this skit as like objective and secular as possible without bringing in like the actual formal ethics of the church. But if you're interested in knowing that, I'd be happy to talk to you after. But this is just like in terms of nursing nationally, like you have to be aware and confident in these sort of areas.
And our PICO question is, in LGBTQ patients, does conducting prior collaboration and evaluation with the healthcare team compared to not having nurse-physician collaboration before meeting an LGBTQT patient reduce patient anxiety related to healthcare settings within the scheduled appointment?
So this would be like the nurse advocating for the patient by talking to the doctor and making sure he's aware before he is like blindsided in the room.
And we
by
could
this
have
sort of
we could have
situation.
avoided some issues of untherapeutic conversation if the doctor was kind of aware of what was going on with